Hello, welcome to Virus to Vaccine, the only show on television right now which puts the spotlight on the biggest health emergency that the world has ever witnessed. Unfortunately, the pandemic fatigue seems to have led to a resurgence of coronavirus cases, not just here in India, but around the world. But people cannot afford to let their guard down, particularly because a vaccine is still months, if not a year away. Immunity is not long-lasting, and there is really no sure-shot cure for COVID yet. So what do you need to do to stay safe from the virus that has infected more than 30 million people around the world in the last 9 months? Over the next 30 minutes, some of the biggest names in the business will be answering your questions on COVID-19. I'll be joined by Dr. Faheem Younus from the University of Maryland. I'll also be joined by Dr. Dhruv Khullar, who's a doctor and writer for The New Yorker, and Dr. Rajesh Gandhi, an infectious diseases specialist with the Massachusetts General Hospital. Let me start with Dr. Faheem Younus, who's the Chief of Infectious Diseases at the University of Maryland. Thanks very much, Dr. Younus, for speaking with us here on CNN News18. What is your assessment right now of the world situation when it comes to COVID-19? It seems, at least on the face of it, that countries like the US, many countries in Europe, even here in India, are now witnessing what seems to be a resurgence of cases. Would you characterize this as a second wave, or is this just a continuation of the first one?
Thank you very much for having me. The idea of second wave comes from 1918 Spanish flu pandemic, when the World War I soldiers went back home. This time around, I think it's very different because more than 4 billion people travel globally every year. So countries who manage the first wave well should not really have to deal or worry about a second wave. It's about how well we control the first wave.
Now, in terms of where we go with this virus, let's start with medication. For normal symptoms, mild sore throat, mild temperature, what would be the ideal medication that you would suggest? Would you suggest for people who are either mildly symptomatic or certainly the people who don't require hospitalization, what kind of medicines should they be taking?
Exactly. So I like to follow the evidence, and sometimes the evidence does not follow my opinion, and that's okay, because this is a new disease and we all have to walk with the crowd, walk with the scientific community. And the current evidence states that about 80 to 90% of people with COVID do not really need any fancy treatments. You have to understand, 30 to 40% of all COVID patients are asymptomatic. They never develop symptoms. So that's easy, number one. They don't need anything. Those who may have fever, sore throats, anything you will do for a regular seasonal infection, whether that's paracetamol, whether that's ibuprofen, there is still some concern whether we can use brufen or ibuprofen. There is no risk so far that we know of. So you can use all those regular remedies. You can use salt water gargles for symptomatic relief. There is no proven immune boosters, if you will, that we know of. Vitamins may or may not help. We don't know whether they really help. There is no clear evidence unless you are deficient in a vitamin. You don't need antibiotics if you are home. So really, you have to ride the wave if you're home in those 80 to 90% of the cases. You don't need a hospitalization. You don't need a fancy quarantine facility. You have to protect yourself, isolate at home for 10 days, and chances are a majority of people will get better on their own.
So let's do a set of rapid-fire questions with you. Soap and water or sanitizers? Which, according to you, is better to use?
Soap and water is cheap and available and more effective. When you're traveling, when you're out there, when you're in an airplane, when you're at work and you don't have access to soap and water, it's a good idea to have a pocket hand sanitizer. It allows you an efficient way to clean your hands. But soap and water is always better and cheaper.
Is it okay to take oxygen at home if somebody's having breathing issues, or should oxygen only be taken in a hospital?
Yeah, oxygen is, I don't like people to start playing doctor with themselves. This is an area where I think if you're breathless, if you have cough, if you're not getting better, if you're over the age of 65, if you have immune compromised conditions, then you need to seek the help of a doctor. The moment it gets to a point of low oxygen, you should be under medical care. You shouldn't be doing that yourself.
Is reinfection a reality? How many times could a patient who's been infected by COVID get reinfected again?
So this is a very interesting, fascinating area which is evolving. And this conversation to me belongs in the amphitheaters of large university hospitals. This is where we doctors debate these ideas all day. To me, this is not a conversation for social media or for consumption of a regular person. For average citizens, I think the message is we have nearly 30 million people infected in the world.
Yeah.
We don't even have 30 cases. And even it's very hard to scientifically prove a reinfection. Will it be possible? Of course it will be possible. A plane can crash on my house at night. That's possible, but I don't go to sleep worrying about that plane crash. So I think we need to tell people that they shouldn't be worried about a reinfection. They should be worried about preventing the first infection. And that's where our biggest potential opportunity lies.
Is the concept of herd immunity a reality or a myth?
Of course, herd immunity is a reality, but the best way to get to herd immunity is through a vaccine. If 60 to 70% of your population needs to be immune before the transmission chains are broken, we need to get there with a vaccine, because some people argue, why not just let this virus run its course and we will get to herd immunity? Just imagine if less than 10% population of India, 100 million people got the infection, 0.5% died. That's 500,000 people dying. And if 3 or 5% of them required a hospitalization, do you have 5 million ventilators in India? So there is a huge cost to be paid. People who believe that just allow this virus to go wild and we will get to herd immunity is a very dangerous idea.
If I've taken an antigen test and my antigen test shows that I've developed antibodies, how long can I rely on those antibodies to fight the disease?
So I think if somebody has antibodies, we don't know the right answer. It's still evolving. We don't know whether they're 100% immune to the disease. We don't know whether they should wear PPE or not. So our current strategy is to continue to tell people to remain cautious. Those who have recovered from COVID or those who may have positive IgG antibodies clearly stand a better chance at protection. Clearly, they have beaten the virus. Clearly, their body will remember it now. They have all those odds going for them. But still, the way I look at it, a vaccine, if it's 6 to 12 months away, you might want to remain cautious. Don't get paralyzed, live your life, but remain cautious.
Is it all right, though, for me to order stuff online through Amazon or other delivery apps? Is it okay for me to order food online? Or should I sanitize the boxes that these goods or food come in?
Again, these are those rare possibilities. I think the easiest thing is just wash your hand after you handle those boxes. It's perfectly okay to order food or groceries or any packages. I think once they arrive in your house, yes, people can they be extra cautious. I'm not going to stop them from that. I just believe that extra caution is harder to sustain and maintain over 6-12 months. So what I do in my own house, what I believe science supports, that I handle all those boxes, I do whatever I have to do, and then I wash my hands, and that's safe.
Is it okay to go out and get a haircut in a salon?
I've done it 3 times since this pandemic. There are studies out of St. Louis. There are some outbreaks that we've studied by now that if the hairdresser and the customer are both wearing a face mask, something like this, if you're wearing a face mask, then there was no transmission. So I think it is safe with precautions.
Is public transport safe to take? And I'd like you to characterize it as air travel, rail, subway, and bus.
That's hard. Anytime you're in a crowd, I think you're at a risk. So avoiding crowd is the key. It's very difficult, though. I completely understand the realities of life in thickly populated cities around the world. You have to maintain social distancing wherever possible. You have to wear a mask. You have to wash your hands. But anytime you're in an indoor area with a bunch of other people cramped together, to me, that's a high risk environment.
Is it safe to go in for a dental procedure?
Dental procedures, to me, are riskier for the dentist as compared to the patient. So yes, for the patients, it's safe to go to dentists. It's very important for us to take care of our general health, including our dental health. Because if COVID paralyzes us, we don't want people to die of heart disease or lung disease or because other diseases haven't gone on vacation. Other diseases are still around. It's important for you to take care of your dental health. Please make sure whatever the dentist office asks you, follow their instructions, because they're trying to protect their staff who are at a greater risk.
Till what time frame do you believe that the coronavirus is going to be with us? Is it going to be till 2021, 2022, and possibly, who knows, even beyond that?
It depends on our behavior, sir. Really, the virus is innocent. The virus has no emotion. We as human beings have emotions, we have our own agendas, and we have our own human weaknesses. So if you ask the same question in New Zealand or in Taiwan or even in China, they'll say the virus is already gone. Life has moved on because those countries united and they put on a very aggressive, united front against this virus. So unfortunately, where I am right now in USA, we are struggling with the exact same scenario where we're not united as a country in our response to the virus. So if there is a lesson for India to learn, you cannot win against a united virus if you're a divided people. So we all have to come together behind the science. And yes, then you can shrink that timeline to the best case scenario, which is going to be 2021. But if we don't unite, then God knows, I have no idea how long it can go.
And finally, out of the top 5 vaccine candidates right now, which one would you put your money on? The Sputnik V by the Russians, Moderna, or Pfizer, or, of course, the one in Oxford, the Chadox one?
All 5 so far in phase 3 trials. And as I've said many times, to me, there are no favorites. I look at this whole pandemic as one humanitarian issue. I look at vaccines as one humanitarian effort. I'm not wedded to one country or one brand or anything. I do have some criteria. Any vaccine that is well tested in phase 3 trials, meaning tens of thousands of patients, it's safe. The data is publicly published, and the vaccine is approved by a regulatory body. If those 4 conditions are met, I'll be very comfortable taking that vaccine.
All right, Dr. Faheem Younus, many thanks, in fact, for joining us here on Virus to Vaccine and putting all of that issues into perspective for our viewers. Thank you very much indeed. That's Dr. Faheem Younus. Let me now go across to our special guest, our second guest. Dr. Dhruv Kullar is a doctor and a writer with the New Yorker magazine. Thanks very much, Dr. Kullar, for speaking with us here on CNN News 18 and on Virus to Vaccine. Even after developing a vaccine, do you think that there's going to be no end to this virus? Could you explain to our viewers why you believe that even if a vaccine were to be found early 2021, it's going to be a long way off before we hear the end of COVID-19?
Yeah, I think, first of all, thank you for having me on. And I think the vaccine is a very complicated issue, more complicated than most people give it credit for. And so I think the first question is there a vaccine that's safe and effective and approved? And that is one question. But the second question really is that vaccine widely available and accessible to the vast majority of the public? And that is a very different question. So take the first question, for instance, is a vaccine safe and effective? Most people, I think that once you have a vaccine that gives you 100% protection, you get the vaccine, you can't get the virus. That's not always the case. So if you think about something like the BCG vaccine for tuberculosis, it has some protection, or we think about the flu vaccine every year. It has some protection, but you're still possible to get the virus or to get the bacteria. And so one issue is around how effective will that vaccine be? The US FDA has said they'll approve a vaccine that's at least 50% effective, so it'll lower your chance of getting the virus by 50%, by no means necessarily 100%. So that's the first question.
Okay.
The second question is, what percent of the population has access to the vaccine and decides to get the vaccine? So in order to get to herd immunity, in order to get to a place where the majority of a population is immune to this virus, you need a robust public health infrastructure to roll out that vaccine in a safe way and in an equitable way.
By when do you see, Dr. Kohler, by when do you reckon the vaccine would reach, or at least our response to this disease would reach the level of herd immunity? How much of the world's population needs to have this vaccine to achieve that level of herd immunity?
You know, it depends a lot on how effective the vaccine is itself. And so a 50% effective vaccine is very different than a 95% effective vaccine. There are estimates. We don't know exactly what the number is, but some people estimate that about 60% of the population needs to have immunity to the virus to prevent its spread between people. When we get there is not clear. So vaccines like Moderna, vaccines like the Pfizer vaccine, they have indicated that they may have results by the end of this year. I am optimistic that by December, January, February, we have a vaccine and we know that one is safe and effective. But then the second question comes into play is, when is that vaccine widely available to large numbers of the public? We need not millions of vaccines. We not even hundreds of millions of vaccines. We need potentially billions of vaccines around the world, and that could take months and months to get to a place where we have that available.
Now, you have talked about the tuberculosis model of treatment for COVID-19. Can you explain to our viewers, what do you mean by this?
You know, it's possible. So the point I was trying to make in the article is that there's many different ways to fight an infectious disease. I think most of us want something like a cure, a silver bullet, a vaccine that is 100% effective, something like polio, something like smallpox. We get it and we don't have to think about it anymore. That is, of course, preferable. But there are many other diseases, take HIV, take TB, for example, where we have to use a multi-pronged approach to subdue that infectious threat. And there may be a partially effective vaccine. There may be one or multiple medications that you have to take. We do have medications in development for the coronavirus as well. But there's still a need for public health strategies, things like good hygiene, good housing, widely available testing and tracing, isolation if that's needed. And so the point around the tuberculosis model or an HIV model is that we have a suite of interventions that can ultimately be quite effective in bringing down both the deadliness of the threat as well as how contagious it is.
All right, Dr. Dhruv Kohler, we'll leave it at that. Thanks very much for joining us. I'm going to take a break on that note here on Virus to Vaccine. When we come back on the other side, we'll have another special guest, Dr. Rajesh Gandhi, on what this sudden resurgence of cases, whether it's in the US, Europe, or in India, actually mean for our fight against this disease. Quick break. We'll see you on the other side. Welcome back to Virus to Vaccine. We're in conversation now with Dr. Rajesh Gandhi from Massachusetts General Hospital. Dr. Gandhi, thank you very much for speaking with us. Do we have a better sense now, 6 months into this pandemic, of what are the kind of drugs that work against this disease? Now, if that is so, what are the forms in which that drug can be given or administered to the patients, whether it is mild symptoms to heavy symptoms?
Remdesivir is an antiviral. We think that antivirals will work earlier in the course of infection, and then because the infection causes a lot of inflammation, hyperinflammation, we think that anti-inflammatories will work later. So what we learned in May is through a large trial done in the US that remdesivir did show benefit, at least in terms of improving time to recovery, if given to people who were in the hospital and who had severe COVID-19. What do I mean by severe COVID-19? That means people who are on oxygen or in some cases on even a ventilator. Now, what we also learned really in June, May into June, is that dexamethasone did reduce mortality, reduce deaths. It had its biggest impact in those people who were on ventilators. and also had some impact if you were on oxygen. But if you weren't on oxygen, if you had mild disease, or if you were not in the hospital at all, we would advise against dexamethasone. It really only works for people who are quite ill. So those are two examples of things we know now that we really didn't know in March. We also know quite a bit more about what doesn't work. Hydroxychloroquine was a drug that we gave in March, but then when trials came out, really in June, once you're in the hospital, hydroxychloroquine really does not show any benefit. And that's something we know now that we really didn't know a couple of months ago. So even though there's a lot we don't know, there's also more that we do know.
We had earlier this week the Pfizer CEO say that the vaccine should be out by the end of the year, and that he expects that Americans would get the first dose of this vaccine as early as the end of the year. Are you as optimistic as him? Would you be in a position to say that whether by the middle of next year this disease would be under some sort of control, that at least half the world's population, if not a third of the world's population who's infected, would have gotten access to this vaccine?
The thing to say about vaccines is it's not just do they work, it's also are they safe, because you're giving vaccines to people who don't have any illness. And so that safety information as to when we're going to have that, it's very, very hard to say. Pfizer did announce this week that they're going to expand their numbers from about 30,000 to about 44,000. And so I believe that's so that they can get more safety and more efficacy information even more quickly. Hard to know if they're going to be able to do it this year or whether it'll go into next year. All I can say is that all efforts are being made. In terms of when will we have control? That is the million or billion, trillion-dollar question. When will we have control? I will say vaccines, if effective and if safe, will have a major role, but it's going to be also implementation. Can we get these vaccines out to a large number of people in a very short period of time? And I think during the time of vaccine rollout, social distancing, masking, hygiene, those are all going to remain critical. I don't think we can relax our guard for some time now until we have an effective vaccine and until the numbers come down. When you have high rates of numbers like we have in the US, like there are in India, you have to get those numbers down to get control. And vaccines will help, but it's going to be a combination approach. It'll be vaccines plus behavioral changes. It's going to take all hands on deck to really make a difference and get this under control.
I want to get a final word from you. Many experts are suggesting that there could be a resurgence of cases in the coming winter months, in the colder months of the year. Is there any evidence to show that temperature and the progress of this vaccine are linked?
It's a good question. I would say that people had proposed, some politicians had proposed that maybe the virus would go away in the summer months here in the US. That didn't happen. The numbers are still quite high. And so what that teaches me is that this is not a virus that will just go away with temperature. The worry that we have in the US is because in large parts of the US, it's very, very cold. People do tend to stay indoors. And we do know for a fact that there's more efficient transmission when people are indoors, especially if there's poor ventilation, than if people are out of doors. And so that is why there is substantial worry come the winter. We're in September now, that there may be a resurgence of cases. And that's why every efforts are being made to try to keep our guard up to prevent that resurgence. Also, we know, or we fear, that if you have both COVID-19 and another respiratory infection, something like influenza, which tends to be in the winter months here, then the two may promote each other or make things worse. And so the big push right now is to get as much of the US population immunized for influenza as we can to try to at least protect against that. We do have an effective vaccine for influenza. So yes, there is concern, and it's not so much about the temperature sensitivity of the virus. It's more about human clustering in cold countries like the US. When it becomes winter, people tend to be close, and that's when transmission is efficient.
All right, Dr. Rajesh Gandhi, thank you very much for joining us here on Virus to Vaccine. That's a wrap of this special weekend edition of Virus to Vaccine. That entire episode goes up on our website, news18.com. From me, Zakir Jacob, and the rest of the team, we'll catch you again next week, same time. Until then, good night, stay safe, and stay healthy.